I'm Dr. Mollie Marti, and welcome to Resiliency Matters. This is where we take the big resiliency research and best practices and break it down into small, bite-sized pieces that you can begin using immediately to strengthen yourself and others. What if you could learn the 3 most important pieces to being prepared for disaster? Would you spend the next 28 minutes with us? What if in the next 10 minutes you could learn the most important piece to build resilience and what you can start doing today to strengthen it? Would you hang out with us? Who is us? My other half of us today is Linda Langston. Linda is a county supervisor for Linn County, Iowa. She also is sitting president of the National Association of Counties, NACO. NACO covers counties across the United States. And as president, Linda gets to pick an initiative to focus on, and her initiative this year is Ready and Resilient Counties. Welcome, Linda.
Thank you, Dr. Marti. I appreciate the opportunity to be here with you.
Well, I know we have a lot to talk about, so let's get started. You had a leadership position during the great floods of 2008, as they're known here. For those not familiar with the floods, tell us a bit about what happened.
Well, there were 83 of the 99 counties in Iowa that were impacted, some by tornadoes, but some by floods. So in my home county, Cedar Rapids, Linn County, Iowa, we had a very significant flood, the worst we've ever had in recorded history. 10 square miles of the community were engulfed in water. We had to evacuate a hospital, a jail, lots of roads closed, 25,000 people evacuated. So it was really a big deal, and I happened to be chair of the board that year.
Well, lucky you, lucky us.
Me, yes.
So how did this experience shape your view of resiliency?
I think what I really came to understand was it is important to think ahead. It is important to plan. And it's also very important to have relationships that help you in recovery.
And I think we're going to be talking a lot about relationships today, and I love that segue because I mentioned to you, I printed this out, and you're familiar with this study, but it's a study I want to share with our viewers. There was a poll done recently of 3,000 people in New York and New Jersey affected by Superstorm Sandy. And the poll explored the resilience of people and neighborhoods directly impacted by Sandy, the most important sources of help before, during, and after the storm were friends, family, and neighbors. Friends, family, and neighbors, those relationships that we're going to be talking about today. About 1/3 said that they reached out to friends, family, and neighbors for assistance in the aftermath of the storm, rising to 47%, nearly half of the people surveyed in the extremely affected areas. The level of trust, something else we're going to talk about today, in a neighborhood is an important signal of resilience and rebuilding. Neighborhoods lacking in social cohesion and trust reported having a more difficult time recovering. Individuals in the slowly recovering neighborhoods, and I want to give you a few statistics, they were less likely to believe that people can be trusted, 31 to 44%, or that the storm brought out the best in people, 68 to 53%. So there's a lot of distrust and in their neighbor and in people in general. Individuals in slowly recovering neighborhoods also are more likely to report greater levels of hoarding food and water, 47 to 25%, looting and stealing, 31 to 7%, and vandalism, 21 to 5%, in their neighborhoods during or immediately after the storm. The encouraging news, there is good news, is that overall the storm brought out the best in neighbors, with reports of people sharing access to power, food, and water, and providing shelter. Just 7% reported that the storm brought out the worst in their neighbors. I think this is such interesting evidence about those relationships that you mentioned, about the connections between families and neighbors and communities. What comment do you have on that study?
That would be very reflective of my experience in our own community here. I think for the most part, that's where people do turn. They look to trusted people. Mm-hmm. And I believe that Cedar Rapids' recovery from the flood has been facilitated by the fact that we do have strong neighborhoods, that we do have people that we can trust in. And I think that in crisis, really brings out the human desire to do something good beyond themselves. And we saw that over and over again. I think people really are hardwired to want to help, to do something good. A lot of it is giving people the opportunity to follow through on what their heart tells them they should do.
And that is such a wonderful mirror to the work of the Community Resiliency Project, and I know you're a bit familiar with that, but that's exactly our message in supporting these youth, is that they are designed to contribute and serve, and as they have opportunities to do that, they not only strengthen our community, but they strengthen themselves. So you're seeing this as a universal human need.
I do. I mean, that's the way I come to the world. So anything I can do to facilitate that in people, I oftentimes think it really is just giving folks the opportunity.
Yeah, okay. And so to give us a better sense of your position as the president of the National Association of Counties, how many counties are there? What is the work of our counties?
Well, it's a big thing because there's over 3,000 counties nationwide. We do a lot of the health, transit, roads, emergency management. Those are all key. I think the other part is that my goal is to make sure that counties across the nation have the particular tools that are going to assist them in being prepared, in thinking ahead of time. Sadly, government is often reactive. This requires being proactive, and we are in those places that really allow us to help people. So post-disaster, that's counties really at work. So I want to be sure that people are thinking about it and that they have real tools that they can use to help their communities.
So that's more human nature to be reactive than to be proactive, the downside of human nature coming out. So in short, what is your goal with ready and resilient communities?
Well, I think talking about how people can really assess their community so that they can have the tools to understand what might be the areas that they need to improve in, what can they do to prepare more. Do they understand what the plan is in their community? Are they doing their emergency drills? Really prodding people to take to their best efforts.
And we're going to talk more about being proactive in that way. So tool number one, family, neighborhood, and community relationships are vital pieces of resilience. Prioritize investing in and nurturing relationships. When we come back, we will be talking more about being proactive and the key steps you can take to be prepared in the face of disaster. I'm Dr. Mollie Marti, and welcome back to Resiliency Matters. Today we are visiting with Linda Langston, President of the National Association of Counties, as well as a supervisor for our own county here in Iowa. We were talking about helping humans, constituents, people, and this applies to the youth we work with as well, overcome that delay or that lack of urgency. And I found a really interesting pairing between that post-vention crisis response and the proactive resiliency building. You know our background with the Community Resiliency Project. Right. We lost 3 young people to suicide, and so of course we just dove right in to try to strengthen our youth and strengthen our community. At the same time, we've always had this goal and a focus on building stronger youth and community. What is your experience with those two things, that reactive and that preventative? Any guidance on that?
Well, I think that actually resiliency is and planning really are a very circular process. So literally the minute some kind of crisis or disaster happens, you start reviewing what just happened and planning for the next one. And that is just life. And that's one thing we know about disasters. They're happening more frequently. They're coming with more expense. And so you really need to be anticipating and planning ahead. And that's really true in any crisis. You can't assume that it will not happen. You actually have to make the assumption that it will.
And even in Cedar Rapids, didn't they have a 100-year flood and then a 500-year flood? Is that?
Well, I've often said that if I use those numbers, I would be about 3,000 years old, and so I know I'm not. So I think that's the anticipatory. You have to understand that there is some change going on, and what can you do to be prepared? So that really requires people as well as governments to really think about what can they do to anticipate. So those are all critical in our functioning, that we really do need to take time in our busy lives to anticipate what do we need to do, and then we as government officials need to think about what do we need to do to help the community be prepared.
Mm-hmm. And the same is for leaders on so many levels. I'd really like to challenge our viewers today to be thinking, how does this apply in my home? How does this apply in my child's school or as a teacher in my classroom? How does it apply in our community? And we'll continue to connect those dots. But our viewers might need to be thinking, oh, they're talking government, but that really applies right here in my home. What do I need to do with my family?
And I also think both family and in government, you can challenge your city officials or your county officials and ask them, what are you doing to help us be prepared? Many people may not know, but particularly because we have a nuclear power plant in our community, we're required by federal law to drill 4 times a year. So are people doing this wherever you live in Iowa? Are your elected officials going to a drill? Sometimes it tends to get farmed out, which I understand because people are busy, to a fire chief, to a police chief. But it's really important that the mayor and the city council and the county supervisors go to those, because each crisis and disaster is different. And you have to be prepared no matter what it is. So a few years back, we had an issue with flu. Iowa has issues with measles outbreaks. That's going to look very different than a flood or a tornado. And that really takes time of being in a room with all the colleagues that will be there. Schools are there, hospitals are there, and that's part of the relationship building as well. When you're sitting in a room and you're planning, you get to know people. So then when the crisis is there, you're actually talking to people you know. You're not coming out there and then being surprised by how many people are involved.
And my familiarity, again, is with the school, and so we've created a crisis intervention protocol that wasn't in place for Iowa schools to be using, so that when, whether it's a suicide attempt or another crisis, they know who does what are the next steps, and to get those done on paper, and then to be educating staff about what that looks like. And I think it really is important to our viewers to have a challenge here of advocacy, that it's good to go to your schools and say, what are you doing to be planning, to be drilling, and to our county officials, to our cities, to all of those officials, to be asking those tough questions, because it makes a difference. It saves lives.
It really does. And the old adage we all heard when we were growing up, practice makes perfect. It really is true. So if you practice that, because oftentimes that's the challenge of a crisis. You're so overwhelmed. It is the practice that helps you get it right at that moment.
Exactly. So we keep coming back to relationships. I knew that we would, but it is, I saw how the police officers worked with the school leaders and the business leaders, and so I've seen this at a microcosm. What's a practical tip that you can give about investing in and nurturing those relationships?
A lot of it is about building the relationships before the crisis happens, because as I've often told people, you do not want to be in a crisis situation and having to get to know someone that you're going to ask for help. If you need help, and the whole, as you noted, the research is about trusting relationships. It's important to have those relationships built ahead of time, to know them, and to trust the people enough that you can call on them and say, I need your help in this. And so that is really a significant thing, and that takes time.
It takes time, and I think it really takes a mindset of investing, of giving, of not starting out saying, what do I want or what do I need from this relationship, but how do I invest in this?
Right, and so how do I come to the table and understand, what do I do in different situations? Who can I call on? So again and again, the practice, the drill, the calling people up, making sure you know who you can reach out to. And that's true for individuals as well as for government officials. You want to know, who do I call? Who do I call when this happens? So there might be people at the federal level that you're going to call. You may be calling congressional leaders. But also, if you're in a family situation, you want to know, who do I reach out to?
And we're going to dig into the nitty-gritty of those type of specifics and who do you call and how do you contact in an emergency. We have some great resources coming up. But let's give you tool number 2. Get clarity about who could help you in a time of crisis. Record their contact information today. The 3 most important things, specific things you can do to prepare your family for a disaster or a crisis. Stay with us. Hi, I'm Dr. Mollie Marti, and welcome back to Resiliency Matters. Today we are visiting with Linda Langston. We are talking about preparing for a disaster, but also just building resiliency. And you are a wealth of information on what resources are out there. There's so much that the government is already doing to provide resources. You had sent me the link to the federal government site, www.ready.gov, and that site shows 3 key steps to disaster preparation. So let's go through these steps. The first step is be informed.
Right. I think you really need to look in your community what's the first step you need to take depending on what the emergency is. A lot of it is really going to ready.gov and other resources in your community so you know where to go and what to do. Some of those are important for people who have pets or if you have relatives that have some significant health needs. There are certain plans that you can make to be prepared ahead of time, so you need to get that information.
And I looked around that site quite a bit this morning, and they break it down to be prepared for natural disaster or
Right.
be prepared for a terrorist incident.
Yes.
Or be prepared for different
Health
types
disasters,
of health.
yes.
Exactly. And so that was really useful.
Yes.
So it's really that first step is just educating yourself about what needs to transpire to
Right.
see your family and yourself safely through this. Okay, the second step, make a plan.
Yes. Make a plan. You really need to think about some things. If you have a family that maybe lives all around, where are you going to meet? Or if you have kids in school and you're at work and something happens, if a tornado goes through town and it happens to have hit your home, God forbid, where will you meet? So you really need to think about those things ahead of time and actually sit down and talk about those with your family. What are the key things that you're going to have ready if you're in your house and you have to leave? If you have to leave really quickly, you don't have time to go rummaging around for those things. You need to have those things close at hand. So I encourage people just to have a contact list. You know, I know a lot of things are in our phone, but sadly we saw lots of people drop phones in water and then phones don't respond very well. Then your contact list is gone. Paper and pen works really well. So it's really good to have those backups as well.
So that make a plan really kind of covers the who, what, when, where, all of the logistics of it. And then the third step is building a kit, a survival kit.
It really is, because a lot of people don't realize that, and this was very clear in Hurricane Sandy, it could be up to 72 hours before you're going to see help. So what do you have to be able to survive? So water is key, some food supply, making sure you have like candles, blankets, because if there is no heat, those are all things that you need to anticipate ahead of time and you need to have on hand, because even though we're all here to help, sometimes executing that is very difficult. Colorado was a good example. The wildfires that came after the floods, in some cases there just was no way to get to them. And so having that, anticipating that is really important, and it really does give you a peace of mind to know that you're prepared and you can take care of yourself for a few days.
So those are some great tips, and we're going to put those on screen for our viewers a little bit later. But I want to talk about the relationships as well. I read from that study. We talked about the importance of relationships. You've been in the field. Every time I talk to you, you're traveling here or there in another state and visiting with counties. And I am recommending you go south for the winter. We've had that discussion. There's a lot of counties south of us here or there. But what are you seeing in the field? Can you share a story or two that you thought, wow, I know relationships are important, but now I really get it?
Well, they really are. I know that in the floods themselves, there were situations Johnson County to the south of us had a lot going on. So Sally Stutzman, who's now a state representative but was a county supervisor at the time, called me several times and said, Linda, we need, pick something, send it down. And I knew exactly what she was talking about. She was calling me because she knew me. I also knew that when we were sitting in the Emergency Operations Center, the city had sandbags, but they had no trucks to spare and they had no sand to spare, and we needed sandbagging. So he just, literally, it was someone in the Emergency Operations Center, Dave Elgin, was like, Linda, can you? And so we put the resources together and we made it happen. Our website was up, but the city's was down. They were all being run out of informatics, and they were on the second floor above the Blue Strawberry at the time, and there was nothing but water around them. They had to leave because they'd been up there for 5 days without a shower, without sleep. So they left, and then they wanted to come back in. They were operating on generator power. And so I had to go to the fire chief and say, I need these folks back in. And at the time, they were letting nobody downtown. Curtis looked at me and said, is it mission critical? And I said, yes. He said, okay. He didn't ask me why. He knew me well enough that he could ask that question. Is this mission critical? Yes, it was, because that's the way we were getting information out to the public. That can only come out of the relationships you have. So those are the kinds of things that are there. And I've had colleagues around the country, the same thing. They know I've been through a disaster and something's happened to them. Could you help me with? So those are built on relationships.
And we are getting those type of calls too. You begin to do that resiliency building and work,
you do.
And then you're really
get the calls from all over.
But you're laying that groundwork for those that are coming behind you. But then they'll turn around and help someone as well.
Yes.
So those are great examples. I also know you're very well read in the area of community or county resiliency. Yes. What is on your bookshelf these days?
Well, right now there's a book out there called Healing the Heart of Democracy, which is by an author named Parker Palmer. Mm-hmm. And it really speaks to what we as individual citizens can do to build our communities in order to have the democracy that I think we all want. So there's another book out there by a man named Peter Block called Community Building. And a lot of it is really based on so much of what you and I have spoken about today. It's about building relationships. It's about sitting down and taking time. It's about anticipating what's the community that you want to have. We all want to have a resilient community. We don't want bad things to happen, but we know they will. So if we're prepared and we have the relationships that will help us both survive and thrive, I think that's the key, is communities who prepare, whether it happens or not, they're resilient.
And that really brings that piece together we were talking about earlier, where I said, what is that marriage between being reactive or dealing with the crisis and being proactive? And you're saying whether a crisis comes immediately or a long way down the road, just this work of coming together and doing this planning, having these conversations, asking these tough questions in your home, in your classroom, in your community, in your county, just preparing and looking at these things in itself builds resilience.
Yes, it does.
So I think that's such a great takeaway. So here's that specific tool, third tool that we talked about. 3 keys to recovering from crisis. Number 1, be informed. Number 2, make a plan. Number 3, build a survival kit. You have a lot more information for you. All you need to do is go to www.ready.gov and then take action. This is Dr. Mollie Marti. Thank you for watching Resiliency Matters on MediaCom MC22, your local programming leader.